8 signs of cardiac diseases that should not be overlooked. Many of the signs of cardiac diseases can also be associated with other less serious ailments. However, regardless of this, you should still pay close attention to these symptoms. Do you know the signs of cardiac diseases? Cardiac diseases have become the #1 cause of death in the world. In fact, every day the number of diagnosed patients increases. These diseases directly affect the functions of the heart and, in addition to that, compromise the health of our arteries, circulation, and brain. Their principal causes usually have to do with a sedentary lifestyle and poor diet, but they can also be influenced by certain genetic factors, stress, and poor daily habits. The most worrisome thing is that the majority of the time they develop silently, so they're impossible to detect and treat at the most opportune time. Consequently, they create many complications within the body and, after time, one's quality of life is reduced. For this reason, it is extremely important that you pay attention to any symptoms that you notice, keeping in mind that they can be similar to other health problems that are less serious. In the following article, we are going to share 8 common signs of cardiac diseases so that you can keep them in mind from now on. 1. Chest pain. Chest pain is one of the most common symptoms of cardiac disease, however, it can also be caused by more common conditions like acid reflux. The majority of people think that this sign is one of the first to show when our heart is not doing well. However, the truth is that it only occurs when the disease has reached a higher level of severity. Despite this, you should not ignore this condition, especially if it is a recurring and intense pain. 2. Pain all over the body. Although pain or burning in the chest is common when you are experiencing a cardiac attack, you should not ignore the fact that these attacks can also affect other parts of your body. Often, heart problems affect blood circulation and blood pressure, which can cause uncomfortable reactions in the systems close to the heart. Stay alert if you experience pain in your shoulders, arms, back, neck, jaw, abdomen. 3. Abnormal pulse. Measuring your pulse is one of the most common methods for detecting if something is not right with your cardiac system. Although it's normal to experience occasional changes, it's extremely important that you get a follow-up when it is happening continuously. In the majority of cases, its variations are accompanied by a debilitating sensation, dizziness, or general discomfort. 4. Lack of air. Losing your breath suddenly without having given strenuous effort can be a sign of asthma or chronic obstructive pulmonary disease. Also, it can be caused in some cases by heart attacks or heart failure. Its presence indicates that the blood is not transported oxygen optimally and, because of this, you cannot breathe normally. 5. Sweating. Abnormal sweating, especially in a resting state, can be a sign of cardiac difficulties or a sudden heart attack. In the last case, it usually begins with the sensation of cold sweats moments before the central attack. 6. Pale skin. When someone has cardiac problems, the blood is not being transported correctly and, since this makes the oxygenation of the skin more difficult, it tends to look pale or sickly. 7. Inflammation of the joints. There are many chronic illnesses that can cause joint inflammation. However, you should not ignore this issue because it can result in problems with high blood pressure. In these cases, it is due to retention of fluids in the tissues. This can affect circulation and the elasticity of the arteries. 8. Fatigue. This symptom tends to be found more regularly in women and can occur moments before a heart attack. However, for those who suffer from it, it develops weeks prior to the cardiac problem. The sensation of tiredness comes from the difficulties your cells have oxygenating, since circulation through the arteries is more challenging. Of course, this is a reaction that can also be associated with other symptoms, since it's very common in the majority of illnesses. Adopt a healthy lifestyle and try to stay active in order to greatly reduce your risk. 6 ways to reduce your heart attack risk. Heart disease is the #2 killer, resulting in approximately 275,000 deaths annually. But you can dramatically decrease your chances of having a heart attack, and other vascular complications like a stroke, simply by knowing and addressing the most important risk factors for heart disease. 1. Stop smoking. If you smoke, stop. If you can't do it on your own, utilize the many tools, both behavioral and pharmacologic, to help you. Quitting smoking is one of the biggest favors you can do for your heart. One recent study found that not smoking lowers your risk of a heart attack by more than 1/3. 2. Eat Mediterranean. Again and again, clinical investigators have found that a Mediterranean diet lowers your risk of heart disease and overall mortality. The diet is easy and delicious, consisting of whole grains, fruits, vegetables, legumes, fish and low-fat dairy products. Key components include nuts, olives, olive oil and red wine in moderation, 1 to 2 glasses per day for men, 1 for women, which have independently been shown to reduce your risk of heart disease. In fact, the positive impact of the Mediterranean diet is almost as great as not smoking. 3. Exercise. It's a no-brainer. Physical exercise will help keep your heart healthy. Set a realistic goal to exercise for half an hour 3 times a week. It's enough to reap many of the cardiovascular benefits of physical activity. Additional exercise is better to a point, but going overboard with strenuous daily workouts may actually undo some of the benefits, so be careful not to overtrain. 4. Stay lean. Accumulating fat, particularly abdominal fat, is a big risk factor for heart disease, so this is another reason to eat right and exercise. 5. Get social. Psychosocial factors play an important role in limiting your risk of heart disease. Stress, anxiety and depression all increase your risk. Having a strong social support network, friends, family and colleagues, lowers your risk. 6. Consider prescription medications. If, despite your best efforts at improving your lifestyle, your blood pressure or cholesterol profile is still out of whack, see your healthcare provider. Medications that lower your blood pressure and your LDL cholesterol, the so-called bad cholesterol, have been shown to reduce your chances of a heart attack or stroke. Similarly, if you are diabetic and haven't been able to control your blood sugar with lifestyle changes alone, make sure that you and your healthcare provider are working together to improve your blood sugar control. The majority of heart attacks and strokes occur in people with at least one risk factor. The more factors you have, the greater your risk. Many of these risk factors are largely under your control. The year is still young. Make a resolution to follow a heart-healthy path, and make an appointment with your healthcare provider if you need guidance. Unclog your arteries by eating this one simple fruit. Heart disease is the top killer disease in the world, particularly in the West. Anyone can have this health problem, regardless of the age and background. Oftentimes, heart disease is related to atherosclerosis, which is the thickening of walls in the arteries because of plaque buildup. There are drugs that can help combat cardiovascular problems, but if you're looking for a natural method, there's a substance that can actually prevent cardiac mortality and heart disease. This natural substance is in pomegranates. Scientific studies. Pomegranates have been a subject of some scientific studies, including a 2000 study published in the American Journal of Clinical Nutrition, which showed that the juice of the fruit has anti-atherogenic effects. This means it can prevent formation of fatty deposits in the arterial walls, thanks to the antioxidants in the fruit. A 2004 study performed by Israeli scientists on patients with carotid artery stenosis, or those whose arteries that supply blood to the neck and head narrow. A group was given pomegranate juice for 1 year and half of them continued to drink it for 3 years. The study showed that they experienced reversal of up to 30%. Their blood pressure decreased as well. A 2013 study published in the Atherosclerosis Journal concerning mice with genetic problems related to spontaneous coronary artery obstructions. These mice were given extracts from the fruit. After 2 weeks, the results showed their atherosclerotic features decreased. The same study showed that pomegranates also lower oxidative stress and vessel wall inflammation. But how does the pomegranate fruit do all these heart-friendly capabilities? Long story short, it has scientifically proven properties that include anti-inflammatory effect, since inflammation is one of the main causes of chronic diseases, including heart disease. Lowers blood pressure, which reduces strain on the heart and the arteries. Antiviral and antibacterial properties, which is helpful in fighting plaque buildup, since secondary bacterial and viral infections, including chlamydia, pneumonia and hepatitis C, can contribute to arterial blockages. Antioxidant that flushes away toxins and reduces oxidative stress. A small part of plaque can already block your arterial wall, and this can cause blood clots, which could hinder the flow of blood to the heart. As a result, stroke or heart attack can happen. Atherosclerosis is a cardiovascular disease that can be caused by a number of problems, including high levels of LDL cholesterol and endothelium inflammation in which the cells in the inside of the arteries develop atherosclerosis. Pomegranates and pomegranate juice or extract can stop atherosclerosis and heart disease because of the antioxidant content, mainly the polyphenols and vitamin C. Add this to your daily diet, especially if you're at risk of developing the disease, to cleanse your arteries and free yourself from worries.